I'm so excited to be introducing Dr. Mike Smith. I've known him for a really long time. And I just love the way he practices. We met a long time ago, probably what, 10, 15 years ago? Is that probably
Yeah, somewhere in that range.
something like that?
Yeah, definitely.
We're part of this Juice Plus community, which I love Juice Plus if people know about that because the product is like plant-based. But one of the other things that I love about it is the community of people, because you just meet like-minded people that want to help people more holistically. And then that's how I met Dr. Mike Smith and started asking him a lot of questions about what he does and what is a naturopathic doctor. I have no clue. I didn't know at the time. And then he was explaining a lot of different things. I'm like, oh my God, that sounds amazing. So that's what we're going to talk about. So tell us a little bit about yourself, Dr. Mike. And yeah, let's start there.
Sure. Awesome. Hey, thanks, Stephanie. And yeah, it's been great to have a relationship with you over all these years as well. So I'm a naturopathic doctor, and I've been practicing as one for a little over 20 years now, and love what I do. And I have a practice that's based in Charlotte, North Carolina, but work with people all over the country and even a few other countries as well. And I think one of the things you asked about was kind of like, what is a naturopathic doctor? Because honestly, when I first learned of it, I had no idea, and I didn't even know it existed. I had no idea what it was, and I came across it because I was really, really fascinated in nutrition as an athlete in college, and just read every book I could find on nutrition, and eventually read one written by an ND and didn't know what ND stood for, and looked up and found naturopathic medicine as a naturopathic doctor, and looked at, like, is this legit? Like, is this real? Is this a real thing? And I realized it was. And for me, it was really interesting because I wasn't ever on a path to become a doctor. That was never a thought in my head or anything I was really passionate about. But I was really interested in health, and I really wanted to help more people in a positive way with that. In fact, I was considering going to grad school for exercise science, and had interviewed at a couple of schools, but just didn't feel like the right fit. And when I found this, I was like, oh, I think that's it. And I'm super excited that I did, because I absolutely, love the what we do in our profession, the way we impact people. But the biggest thing that is helpful for people to understand is that we are trained as primary care physicians. So as a naturopathic doctor, we have the same medical training as an MD in family practice, but we're trained through a different approach, or sometimes I talk about it as a different lens that we look through. And so if you think about this, your primary care doctor, for example, is really looking you through a lens of disease. And what I mean is that their training is to understand and look for diseases and figure out where's the disease at, and therefore what drug or treatment do you need for the disease. We're trained through a different viewpoint, and that's really one that's trained to look at you through a lens of health, to really understand, okay, where's your health at, and what's going on, what's impacting your health or causing your health to be in dis-ease, and then how do we help to correct the underlying root cause of that, to take you beyond just dealing with symptoms, but really to a place of optimal wellness. And so it is what people often talk about as a holistic approach, in that we treat the whole person. Like, this is the thing, like, people might come to me for migraines, for example, and I can't help just your migraines without helping your digestion and your skin and your energy and your sleep and everything else.
Yeah.
Because all of these things are related. And so we treat the whole person, and we take a comprehensive approach, because we really want to help to fix the problem. And it's really not about like us fixing the problem. It's teaching you to fix the problem so that you can own your health and continue to do the right things for the rest of your life.
Yeah. And and my practice is very similar, which I know when people come into my office, I always tell them, where the side of the pain is often not where the source of the problem is. And we've got to look at the whole body, because it's all connected. And when I sat down and was having a conversation with you, it was like, well, you could have blood pressure issues, and you could have this issue, and you could have this issue, and you could have this issue, but there's usually one thing that's creating a lot of it. We've got to get to like the root core of that, versus here's a pill for this, here's a pill for this, here's a pill for this, which is kind of what the medical system does. And, let's do a test here, and this test shows this, but it means nothing unless you can put all the pieces together. And that's the frustration with a lot of people in the medical system, because they just don't feel good, and they're like, there's something missing. Or what happens all the time, everything comes back normal on the testing, and they're like, you're fine. You're like, but I don't feel fine. I know something's off. And we see that all the time. And that's when I'm like, oh, you've got to go see Dr. Mike Smith.
Yes, it's so important that people really are able to kind of take a step back, because you have to go to see your primary doctor. And I know people have that experience you just described often, where they don't feel well. They go to the doc says, okay, let's run some tests come back and they're all normal and you're fine. But obviously you're not. That's not why you're feeling. And a lot of times people don't realize why that happens. And there's two reasons why that's happening. One is because your doctors aren't running the right tests. Again, remember, they're looking at you through the lens of disease. And so they're only running tests to see if you have a disease or not. And so if there's no disease, okay, check, you're fine. But wait a minute, like, health is not, the definition of health is not lack of disease. It's energy, it's vitality, like the system works like it's supposed to. And so, that's one of the main issues. But the other one is that they're only looking at your labs that fall outside of the normal range. A lot of times people have no idea how the normal range is established on a lab. And it's actually based on the average of the people that go to the lab. So think about this. Who goes to get lab tests?
People that are sick.
Sick people, yeah. And so the average of a bunch of sick people, and you call that normal, well, we're never going to achieve health.
Yeah.
And so when we work with individuals, the testing we're doing is comprehensive in that we want to understand where's your health at. And then we're looking at your lab values through a very different range, one that's really focused on where those numbers should be for optimal health, not just if they're normal based on a bunch of sick people.
So there's a lot of like people that will say they're holistic and they call themselves variations of naturopaths, but they're the wide spectrum of like someone that has a medical degree versus someone that takes some courses. There's wide ranges. So tell us a little bit about that.
Sure. Yeah. And there is. And so there's lots of, there's health people out there, and they're all well-intended people.
Yes, always.
I think it's really helping to understand, okay, what's their background of training that's going to help to have the understanding of you to guide you on the right path. And so even people that are, health coach or things like that, like they're well-intended people, chiropractors and even MDs that might take some courses and call themselves functional medicine doctors, again, well-intended. But it's like, do they have the comprehensive background to understand what's happening? And so, in our profession, for example, we have all the same medical training. In fact, if you lined up our medical training to any conventional medical school, we actually have more hours of training in biochemistry and physiology and some of those core things, because we need to understand why. Like in the conventional medical world, if the doctor figures out the diagnosis, they're done, because now they know what drug.
Yes, so true.
Yeah, for us,
even for PT, physical therapy.
Yeah, and so for us, that's the starting point. Now we got to figure out why. How do we get here, and how do we help to correct that in a way that helps to restore health and keep you on that road. And so very different. And so we need to understand the body really, really well. And then beyond all our medical training, we're well trained in nutrition more than any other profession out there. Botanical medicine, using herbs to help the body heal, homeopathy, acupuncture and Chinese medicine, physical manipulation, hydrotherapy, counseling. There's lots of tools we have, but it's not the tool that makes the difference. It's the approach that we take. Because there's a lot of practitioners out there that might practice what I call green allopathy, where they use an herb instead of a drug, but they use it the same darn way.
Yeah. And here's a test that says to use this herb. I mean, you see it all the time.
Yeah. And it can provide fewer side effects, but it's still not fixing the problem.
Yeah.
And nothing against symptomatic treatment to help people, be out of pain or discomfort, but we got to resolve the issue that's causing it in the first place. Yeah. And
I think people also don't realize that when people go to medical school, they get zero nutrition. I mean, like most of the time it's like, I got 6 hours of feed tubing is what they got for the most part. I mean, they're starting to add some things in there, but even a day is not enough of really understanding, how nutrition can impact the body.
Yep. Yeah. And you're right on. And there's little to no training at all. And we know, you and I know, that food is the most powerful medicine we have.
Yeah.
It will always make the biggest difference when it comes to your health. And so we really need to understand these things and how it's impacting us. And that's the component of testing we do to understand what foods might be triggering some of the inflammatory
Yeah.
issues in your body, to better guide you making the right dietary changes, because we don't want to guess at this. And there's already enough confusion when it comes to
Oh my
diet.
gosh, there's so many things out there. We should do this and this. And honestly, I can see why people are so confused, but that's where there's just like with physical therapy, you can get to a point, and if there's still something that's not right, you got to get to a specialist to go, okay, this is what's going on. I've seen this before, based off the questions and everything else that you ask. That's why you go to a healthcare professional to get you back to 100%. And it's going to be the same thing with this. So just because nutrition didn't help, you still might be doing the wrong things. That's where you really need to get into a medical professional that understands all this.
Yep. Yeah, definitely.
So what kind of clients do you typically see?
Yeah, there's kind of two categories of individuals that we tend to see. We'll see those people that are generally healthy and well, and they want to make sure they're doing everything right to stay that way, or they know that they just want to optimize how they're doing. They're doing some good stuff, but they want to take it to the next level and really focus on prevention. And we love to work with those people. It's great and it's awesome. The other group of people that we see typically are dealing with some type of chronic illness, whether it's an autoimmune disease, some digestive disorder, anxiety, depression. It could be something that's affecting their brain or mental function. There's all kinds of issues that we tend to see in our practice. Diabetes is another common one. And we work with them on helping to resolve the underlying issue that's happening, and really help to educate, teach, and empower them so they understand not just what to do, but really why. And it's really about helping to change course, because what a lot of people don't realize is that the road they're on in terms of their health is not leading towards more health. And so if we want more health, we need to change direction. We need to get on a new road in order to be able to get there, have it, and maintain it. And so we're really good at teaching people how to make the right changes that's specific to you so that you can feel better, recover your health, have great energy, think clearly, digestion works well, and you know how to keep doing that for the rest of your life.
And a lot of the clients that we send to you, they have massive autoimmune type disorders. So we can tell, because once we go and we can see, if something is wrong from a physical therapy standpoint, it's very mechanical. The mechanics have patterns. Everything has patterns. When all of a sudden you're having these pains and stuff, and there's no patterns, but things are improving, but there's still like offshoots, random stuff, I start asking questions, and it's like, tell me a little bit more about what's going on. Like, are you noticing that you're getting bloating, stomach issues, having a hard time eating even healthy foods? Because usually by the time they get to us with some other stuff, and we're noticing like they can't eat green leafy vegetables, they can't eat quinoa, they can't, it's really common, like your gut is a mess and we've got to fix this. And I have the person that can kind of help you. And that's typically what we see. And I always tell them it's a 6-month process. And it doesn't mean that you're going to be back in 6 months. It means that now you know how to navigate your body. You know what is going to trigger it, what's not going to trigger it. You can start telling when you start feeling better, and knowing, because I kind of call it like an overuse injury. It's like you've overused it for so long. And now, just like that stress fracture, if you overdo it, you're still going to feel that stress fracture if enough of your body hasn't healed. So then you got to kind of back down, but you're going to know how to navigate that.
Yeah, no, it's so true. And that's, a lot of times people with autoimmune activity happening in the body tend to be the ones that they often get kicked around from doctor to doctor to doctor because they can't diagnose them.
No.
And this is the crazy thing with autoimmune diseases in the conventional medical world, is they can't diagnose it until there's enough damage to the tissue to then call it something. And they can't help you until they can name it. Well, you don't need to wait, because we can help figure it out and realize that, okay, we need to get your immune system back online, so it's not hyperactive in the way that it's continuing to trigger and cause damage in your own body.
Yeah. And what we find too is that even if you diagnose it, all they want to do is give you a pill. So the biggest thing, what they'll do for the most part when people have autoimmune conditions, is put you on prednisone. So that basically lowers your immune system so you don't notice your symptoms, which is horrible. Now it's a short-term solution. Like sometimes there can be things like flare-ups and it can be a short-term solution, but it's not a long-term solution. and you've got to get your body back into balance. So like, even when people do get a diagnosis, it's, they don't even know what to do with it. So it doesn't even matter, honestly. And we've had patients that are like literally sent to like psychologists because they're like, there's nothing wrong. And I'm like, no, there's something wrong. There definitely, we know there's something wrong. And it's just really sad. Like it frustrates me. Our medical system frustrates me, and it's not from a lack of like doctors not caring, or, well, they're kind of in a system where it's hard. They're just run down, but and it's really hard, but it's like they just don't have the education to understand until they go through something where they can't figure it out. That's when they start switching, and that's when they start becoming a lot more holistic and trying to find different pathways for their patients. But that it takes a lot of people to go through that before you start noticing some changes that are going to happen in our healthcare system. And we're starting to see some of them.
Yeah, for sure. Makes a big difference.
So what else would you share with people that, whether it's something that like, success stories or whatever, like anything else that you'd like to share?
Sure. Yeah, absolutely. It's, and this is one of those things where I think it's important if you're in a place where you realize like, okay, like I don't have the health I want, or the road I've been traveling down is not looking like it's heading to where it is I where they want to go, then we want to help to get you on that right road. And it takes a journey. Like I'm not a magician. I don't have just the natural magic pill that's going to fix you, but the journey is really going to involve, some of the right testing to figure out what's really happening in your body, a lot of education and coaching and support, so we can teach and educate you on not just the what to do, but why, because we want you to own your health so you can be in charge, because it's yours. It's not ours. It's not somebody else's. And we want to make sure that you're really empowered to take control of that. And so you provide all that education you need to help with that, and provide the coaching and support to help ensure you're able to be a success. Well, really, here's your guide. That's our job, is to guide you on this journey to help to ensure that we can get you to where you want to go. Because the thing I see a lot of times with people I sit down with is they want better health, and they've been trying some different things, a little this, a little that, and sometimes even seeing some results, but never really getting all the way to where it's that they're after. So we just help kind of put the right pieces in the right place, guide you through all that, so you can really get to where it is you want to go and own it.
Yeah. We hear that all the time too. Like I had a patient that gave us the analogy of like, when people go to other places, they get you to about like the 30-yard line, but they don't get you to the end zone. And when you come here, like we get you to the end zone, or if we can't, we know where we can send you to get you there, because there's a lot of different components that can create pain and problems. It's not just, orthopedic. There's emotional parts to it that need to be addressed. There's diet parts that need to be addressed. So really just getting people to the right place so they can get to that end zone.
Yeah, so true. And the other thing too is that I think we don't talk about enough is investing in your health.
Yeah.
And in part it's because we have a healthcare system that doesn't want you to think about your health as valuable. In fact, they've trained us to think, oh, if you're sick, just take out your insurance card and go to the doctor, they'll give you a pill to fix you.
Yes.
Like that's not how the body works, right?
Yeah.
And so I talk to people every day about this and helping to realize like this is your most valuable asset. And if that's true, and I'm sure you and others would agree that, your health's your most valuable asset. That's true. How are you investing in your health on a daily, weekly, monthly basis? Like, what's that look like? Do you even know where to start?
Yeah.
And so, one of the things we really do with people, I think we do it really well, is to teach you how to invest in your health, so that you have it for years and decades into the future. Because, if you don't have your health, like it doesn't matter.
No, it doesn't. Doesn't matter how much money you have. Like if you're not living, what are you doing?
And I see it too often where people, they've invested well for retirement and they get there and they show up in my office. Now they don't have the health to enjoy it.
Yeah.
Yeah. And there's no check they can write to get their health back.
Yeah.
Yeah. And so it's making the investments now, because what pains me is to hear people tell me that, oh, it's expensive to be healthy. I'm like,
no, it's expensive to be sick.
Yeah. The cost of cancer, heart disease, diabetes, like these are not only the three biggest killers in our country, but they will rob you of your wealth as well.
Yeah.
And, the leading cause of bankruptcy in the US is for medical
Health.
bill for
Yes.
people with health insurance.
Yes.
Yeah, it's ridiculous. And so,
Yeah.
not only is our goal to give you your health, but it's also to keep you out of the sickcare system.
Yeah.
Like the healthcare system, and I'm not down on doctors. I have a lot of friends that are MDs.
Yeah.
It's not,
Yeah.
it's the system.
It's a system.
Yeah.
It's a system that we're in, and it's bad. And it's getting worse because they literally are spending less and less time. So I always tell people, like, I don't understand how you can figure something out in a 10-minute conversation. Like, it's just, it can't happen. And most of the time when people come in, where they're seeing us, it's like, they're not really sure what happened. It's not like they fell and broke their arm. Here's an x-ray and there it is. It's like, I'm not sure what I did. And that's not a 10-minute conversation. Just like your health is, oh, I feel like something's off. That's not a 10-minute conversation. You can't do it. But that's what the system creates. And so they have to do what's, as best as they possibly can. And that's a part of the problem. So honestly, if you can spend more time finding the people that actually can help you, you will end up spending less money in the long run and feeling way more amazing doing it that way.
Right. Yeah.
Well,
yeah, for sure. Oh.
Thank you so much. This is awesome. I can't wait for people to hear this because more people need to know about this way of practicing because there's not a lot of you guys out there. Well, at least not in Texas. Y'all don't have rights in Texas.
Well, and there's not even in the whole country. I mean, there's only 4 schools that offer a naturopathic medical program.
Yeah.
And they're only producing so many graduates every year. And our profession's been around a long time. 100 years ago, we were the primary doctors.
Yes.
And it's just, unfortunately, the AMA, the American Medical Association has tried to shut us down numerous times and continues to try and keep regulation in our way, so we're unable to practice in certain areas as well.
They do the same for us too. So
Yeah.
we don't have rights. We can't treat across state lines because we are, I guess, dumb when it comes to going across state line. I don't know. I don't get it, but whatever. But yeah, they do the same for us. It's just a part of like what you have to deal with. But
yeah,
when you can find the right medical providers, I mean, it's going to make a world of difference in your life.
Yeah, absolutely. For sure.
Well, thank you so much. This is awesome. Can't wait for it to get out to other people to hear, so people can get helped. Yeah. Thanks, Stephanie. Appreciate you. For sure. And if people want more information on our practice, they can check us out online, carolinasnaturalhealth.com. And I'll put everything in the links below too. So I'll get their website and phone numbers and all that stuff too, so that you can find them. Great.